Mentorship program is something very close to me because I am a product of very good mentorship. And I would want a lot of my junior colleagues and my colleagues to experience that good mentorship. Some of them do have that good mentorship within their institution, but the program that we have at SMA kind of helps them network across institutions, and that I think is a very unique thing. And my goal going forward would be to have more mentors to be involved, especially because the last year we had more mentees than mentors, so that we had to match 2 mentees with 1 mentor, or sometimes even 3 with 1 mentor. So I think going forward we should have a more robust way of getting more mentors into the system, so every mentee will have a one-on-one mentorship. And the other thing that is also something that we should look into, or something that I would want to really look into, is to see if we can have a breakout room at every conference. We have 2 conferences a year, so if we can have a breakout room where the mentee and mentor can meet face to face and have an interaction, so that would actually strengthen that bond more, compared to having a Zoom meeting once in 2 months or 3 months. So those are the things that I would want to focus on. Yeah, so for instance, if a physician in training is having multiple interests, but they're not able to decide on one, or they're not able to focus their attention on one because they think the other option might also be good. So if they want a place to explore everything before making that choice, I think SMA gives them that exposure that they need, in terms of interaction, in terms of the mentorship group. We were just discussing about that some time back. So whatever they want to know before they make that final decision and make that final jump, I think they can get that through SMA, and I have personally experienced that as well in SMA.
That's very cool.
The trainees, including me, I have more than 1 mentor right now. So one is someone in the program, someone outside the program, one for research. So because I want to grow in a lot of different specialties, it's helpful for me if I have mentors in more than 1 group. So it's the same for our physicians and training members as well. So if they are able to have access to someone in the research group and one in the academic group, it's just going to make them a better physician tomorrow. I think, I think many other physicians in training will agree with me also on this. I think there is a big shortage of healthcare professionals in today's medicine, not just doctors, even nurses. So I think, I think it was all unmasked by COVID. COVID kind of showed us how much need is there and how little staff we have, both as physicians or nurses. So I think that's the biggest challenge, and I think that's more than ever important to invest in a physician in training now, because they're going to be tomorrow's physicians. So I think it's very important to invest in the trainees today to make better physicians for tomorrow.